big component of working in healthcare was the government response. So for many hospitals, as I already said, uh, they have a pandemic plan, but they also tend to have a pandemic supply. So essentially, this is a stockpile of PPE, such as N95 masks, gowns, goggles, anything you could think of, flashlights that we would need if a pandemic was going to hit. The problem is, many, if not all organizations, let a lot of these stockpiles expire, or a good chunk of their PPE without replacing it, because a lot of the costs that are associated with maintaining the supplies. So masks have a shelf life ranging from anywhere from 4 to 5 years, which sounds like a long time, but they can quickly expire. So as an example, I don't want to say all, but probably 30% of our PPE was expired, which meant we technically couldn't use it unless we've exhausted all of our other supplies. So part of the PPE documenting was assessing what we currently had in the organization for PPE. So I took all of the PPE within the organization. So we had 2 hospitals as well as 3 satellite locations, and I put it all in one giant room, and I had to count every single individual mask. And then I had to merge all of this organized PPE with a lot of our donated supplies. And the donated supplies, most of it wasn't expired. So we had boxes that were half open, some were closed, anything you could imagine. And I had to organize all of this. So I mentioned earlier that I worked for 3 months straight. And this was a big portion. It took nearly a month alone just to kind of organize all of our PPE and figure what we had. I had to create an Excel sheet. I had to do daily counts. We also had to create some process for taking our PPE and allocating it throughout the organization and counting every single day to make sure we had appropriate supplies. And when we ran out of one form of, let's say, masks, then we'd have to move to the next best thing, and so on and so forth. So there's a lot of moving parts, a lot of stakeholders within the organization are working alone. So I was working with the lab, infection control, all the department managers, our VPs, as well as our CEO. So for anyone looking for some really cool work experience, health and safety in healthcare is a big thing because you do work with a lot of departments and they do come to you for advice and guidance. So when it came to the government response, part of it is all the governments needed to gauge where all the PPE was throughout the province and know which organizations needed more. So this is part of the process of me counting all the PPE and building it into an Excel sheet. We also had to report it daily. So this included weekends as well, all of our inventory. So it went from N95s. So N95 is a NOISH, NOISH approved mask, which has a 95% efficacy for filtering out particulate. So they're designed in different shapes to fit all the different shape sizes of people. So there's not just one type of N95, and I had to document every single type we had as well as the quantities. We also had to document there's different types of gowns, protective footwear, caps, protective eyewear, face shields. They also wanted us reporting all the swabs. So I did for the COVID assessment center, the swabs, we use nasal swabs primarily, and we would send out, let's say 40 during the day, and they would let me know how many they used during that day, how many they have left, and we had to report this every single day. And the last item we had to record was body bags. So the biggest part of my job was centralizing our PPE, doing daily counts, so we also had PPE coming as well. It wasn't as frequent as normal, but this was because a lot of hospitals were put on allocation. So bigger cities like Toronto, they would be getting more consistent supplies of PPE from the government because they were burning through it quicker because they had the acuity. They actually had COVID patients. The most that we ever had while I was working at the hospital was 3 COVID patients. So we were considered less of a priority. So they gave us less PPE. A big component too of the PPE was there was a lot of PPE that we've never seen before. So one type of PPE was called KN95s. There was a lot of masks that were sent from different countries, a lot of masks without proper specs on them, so we couldn't really review the standards. The most common one for procedure masks is called ASTM, and we couldn't find any of this information. So when we couldn't find it, we had to assign it essentially a lower quality rating. And to review this PPE, we worked with infection control, and we essentially created this document, and it goes through essentially when was it made, what is the vendor, what are the standards that was used to test the product, and we go from there and we'd assign one of 3 levels. So one is it meets our current PPE requirements. 2, it's not as good, it's better than nothing, essentially. And then the third option was do not use it whatsoever. This is not safe. Once things became more settled, I had to do a lot more education with new hires. So we made all staff take education in terms of infection control, but also how to properly don and doff your PPE. So I reviewed this with every single new hire, every single student, resident, which doesn't sound like a lot, but when we have over 800 students come through the building in a year, as well as an increased hiring because of the redevelopment project. So on average, we normally hire only 3 to 5 people, and that was increased to 35 to 40. It did take up a lot of time. We also had to rejig how we onboarded. So previously we did once a month, we'd have everyone come in, we'd make a full day of it, and we had to basically design and create all of our content online and reduce the in-person to a shorter time frame. The last thing I want to talk about, which might seem unusual, is pandemic pay. For many people, this is pretty contentious. So when the government first announced a pandemic pay, a lot of our staff were really excited. And this feeling kind of changed a little bit when they detailed who would be included. So first, all of our staff were equally, I'd say, stressed out by the pandemic, but only certain staff were provided pandemic pay, and many people that probably should have been included on the list weren't. So originally, respiratory therapists weren't included, which doesn't make sense considering they are the ones that actually intubate our COVID clients. And then there was workers that were working with clients that weren't, and people who weren't were included on this list. So pandemic pay drove a wedge between a lot of coworkers during a time that was already stressful. And I think you will see that it still does, and a lot of hospitals actually came together and they created a letter to the government saying this should have been an all or nothing kind of thing. So overall, working in healthcare, it was definitely it was a day-by-day kind of thing. It felt like every day was getting a little bit better as we gained more knowledge. The more steady our PPE supplies came through, the less stress staff experience. But at first, it was a lot, and you could see and sense it everywhere. So since my contract has ended, I applied and I'm very thankful, and I got a health and safety coordinator job for my hometown city, which is really great. Um, and during my short time, I feel like I've been able to take a lot of things from Seneca and bring it over into my current role. And a lot of it has to do in terms of infection control and prevention, and making staff feel at ease that way. Excuse me. So I am the coordinator right now of our health and safety or COVID safety plan, which is a requirement for all organizations. So I'm just going to go through some components of it, but not our actual health and safety plan itself. So a big thing of it is staff screening. So this was recently updated by the government to include more symptoms. um, so it is mandatory that all staff do screen each morning. We call it active screening because they have to go through the screening questionnaire and document that they've passed it. It is an expectation of our staff, if they do have any symptoms, not to come into the workplace and to obtain a COVID test. But it is recommended first that they contact their healthcare provider. We also do screening for all of our contractors, as well as the public, where we do, it's called passive screening, which essentially means we have signage posted on doors with the similar, if not the same, screening questions. And the expectation is more of an honor system where the staff or the public aren't supposed to be coming into our building unless they can pass a screening. And another requirement of screening that was just updated this past week was now that if you have an individual in your household with a symptom, just a symptom, the expectation is that the whole household is isolating until that one individual is able to come back with a clear diagnosis. Another big component of our COVID-19 safety plan was the redesign of some jobs and spaces. So if we are unable to create 6 meters difference, that it's important that we introduce plexiglass barriers. So we're pretty fortunate at our city hall that all the offices are fairly huge and mostly one staff occupancy, but a lot of our other jobs for our public works or people working in the public, they're not able to do that. So what we've done is we've created essentially teams and we've staggered the shifts so that there's not as many people there at once. A big thing with our COVID safety plan too has been education. So I've been doing a lot of education on PPE, so that safety talks on masks, talking about the design, washing them frequently, when to wear them, how to don and doff, as well as workplace hygiene and talking to staff about how the virus spreads, how to clean, how often they should be cleaning, how to even properly wash their hands, which doesn't sound like a big thing, but it's viruses can only enter, viruses that are contact precaution. So contact meaning you can only get them by touching surfaces that are dirty, which is supposed to be COVID, is by breaking that mode of transmission, which means the virus can only get in your body either through your mouth, nose, or eyes, or through your skin via injection. So this is why hand hygiene is important, because we're touching so many things throughout the day, and then when we touch our face, we're exposing ourselves. So hand hygiene was a big thing, especially for departments they're not used to it. So we work with mechanics, people that are working in parks. So going out there, talking to them face to face has been a very big thing in trying to get their buy-in. Government response. So I think a lot of our staff are feeling fatigued by a lot of the constant changes. Where are we? What are we doing? So there's a lot of communication that goes into here. And I would almost say that mental health, so I don't know if anyone's heard of mental health first aid, but I highly recommend it because it's really good for this kind of conversation where you are talking to staff frequently and you're trying to provide them emotional support and validate their emotions experience, but also provide them insight that they're not alone and this is how we can proceed, and these are resources. I also sometimes try to preface, so I monitor daily a lot of the updates from public health, as well as the government, but I also know a lot of, because I did work in healthcare, I have a lot of networks in there and I'm constantly keeping in touch with them to see what is coming.